My name is Russell Hendrickson. I'm the CEO of PDS Practical Data Solutions. And our topic for today is successful healthcare dashboard visualization isn't an epic challenge. We're going to talk about 4 proven phases to success. And joining me in today's webinar is Michele Perry. Michele is the Vice President of Web Analytics here at PDS.
Good afternoon, everyone. Thank you for joining us today.
So if we jump right into our webinar topic, visualizations are kind of the rage today. It is probably the #1 business software application, not just in healthcare, but across the world. Organizations more and more are using analytics. But specific to healthcare, visualizations can be very simple. In this case, we have a correlation graph where we're looking at the average score of our risk acuity of our patients and looking at volumes to try to just understand where are our patients, where are their volumes, so we can have very simple visualizations that quickly tell a story. We can do things like maps, and plot all of our patients and where they live in relation to our offices or where they live in a particular geography. That is real simple, point and click, drag and drop, and again, visualization. So it can be a single visualization where we can highlight and review and move, or we can do more complex visualizations. And the example that I'm showing on the screen here was something that we recently helped a customer build out a visualization. We actually used the 4-phase process that Michele's going to talk about coming up in this webinar. In this case, as you can see through the visualization, we're looking at emergency medicine. We're looking at number of discharges by location, by hospital in our health system. We're actually looking at the admission rate and the percentage, and then the acuity level of each patient that was admitted. So we can start to see the average patients very quickly, and we can certainly then see the outliers. We can also look at who is discharged, how many left, and a number of different dispositions, as well as if patients left without being seen, and even how many patients were admitted. And you'll notice, very quickly visually, and this goes back to why we visualize data, you can see that this one particular emergency medicine department has a very high admission rate compared to their, other locations within our health system.
Great. So for the next 50 minutes, we're going to walk through the proven approach for building and creating interactive visual web dashboards. We've actually broken that out into 4 phases. And then we're going to review the common mistakes that impede success and how you can use effective visual dashboards to really promote change within your organization. So why visualize data? So the cliche, a picture is worth 1,000 words. Visual dashboards really allow for simple understanding of your data, easily identify gaps, patterns. They allow for clear communication. By using an interactive visual web dashboard, users can easily slice and dice through the data as well as drill into detail. And by having those visual dashboards tell a story, you can really support change within your organizations. And many of the tools have the capabilities to do all of these. Yeah, so as we expected, we have about 50, almost 60% with high visualization where it's a top priority, and then medium being right behind that at about 40%. So as we would expect today.
Well, thank you for sharing. We've got one more poll coming up in just a second here. Obviously, the very topic sort of expects that if you came to the webinar today, it's probably a priority or it's something that's at least being discussed. And we are certainly seeing that throughout all of our customers. As I mentioned, we only work in healthcare, and there are probably, at last count, I was looking at some of Gartner Group's research reports, 30, 40 major visualization and analytics vendors in the market today. What we see healthcare organizations, though, is typically one of the organizations listed on this slide, from Microsoft to Business Objects, IBM Cognos and Watson Analytics, Tableau, Click, and then MicroStrategy. And I do want to share that we are going to be showing the visualizations that I just showed, and the visualizations we're using in this webinar are from MicroStrategy, and we are showing the MicroStrategy 1010, which includes a product called Dossier we'll talk about later. I do want to stress, though, that no matter what tools you're using, whether it's one on the list here or something else that you've worked into, the phases and the approach that we're using and we've been using here at PDS to help customers be successful work with any tool set. So I do want to share that, certainly.
Yeah, so we've got probably about 50% being between the 0 and 50%. They're doing visual web dashboards. and then split there about 50 to 75% and 75% more, both around the 25%
Yeah, so really interesting that, 44%, almost half the audience is very low on the visualization. And then, if you add the top two categories, the other half, 50% and higher on visual. So pretty typical is what we've seen here at PDS and what I encounter regularly. So let's dig in a little further then, and let's talk about what is really the business challenge around healthcare analytics and visualization. What we see here at PDS is the requests for end users, the people that are actually working with the data, the departments, the administrators, the analysts. They're more and more requesting visual dashboards. It's just increasing, and certainly that's consistent with what we see in the technology industry, outside of healthcare. So really then it leads into, and this is why we're sharing this topic today, how do we address those short-term needs? How do we address what we're doing today to try to drive visualization, get the users the information they need? And of course, everybody in healthcare understands the challenges with the number of different data sets. How do we go about building something that will be sustainable long-term? We can support, we can standardize, and we can easily manage. And that's really where we see today the challenge in healthcare, in part why we're sharing this webinar today.
So visualization is a key initiative to really drive results. So visual dashboards, when you start creating them, you really need to have a good strategy to meet those challenges and to understand the user requirements. So today we're going to talk about the 4 phases that will give you a successful strategy. And the first phase is what we refer to as defining the goals or setting the goals. So it's sort of a 2-part phase, which the first part being identifying the business goals to be accomplished. So what challenge are you trying to address? What business need do you want to improve? Do you want to improve your patient satisfaction? Do you want to improve your physician productivity? And then the second portion of this phase is now you need to break that goal down and really understand what are the key drivers in order to meet that challenge. What are the KPIs and what are the metrics that are going to be able to support and help drive change for that particular challenge?
Excellent. And it's so interesting, as simple as this sounds, it's kind of like saying, well, where do we want to go? What are we trying to accomplish? And yet I'm often amazed at the number of projects or times I've spoken with clients and they say, well, we want to build visual dashboards. We're ready to go. Well, what do you want to accomplish? Well, we're not sure, but we need to go visual, right? So let's take it and break that down to an example, because sometimes your goals are fairly high level. And so I'm going to use a simple example around a fairly complex topic, and let's use denials, right? So let's assume that our goal really is to just communicate the impact of denials. Right? When an organization, or if we're missing something in our process, or we're not clean in our data, our billing, our submission, our documentation, right? We want to just communicate. So we'll have a fairly simple goal, communicating to the departments the impact of denials on the organization, communicate where they're occurring, communicate are we hitting our organizational goals. So a fairly simple approach, but without a clear definition, we could take that same and say, well, what are we trying to do with denials? Well, we want them to understand the cost. We want them to understand what they're actually doing, a much more specific focus. And your dashboards typically have to evolve based on how much information you're able to share with the users. So we'll use that as an example. Michele, can you then continue through the phases here? Let's assume that's our definition. We know what we want to accomplish. How do we continue to break that down?
Great. So during that phase 1, we've got a goal, we have a plan, we know what we want to communicate. So the next piece is that we've identified those key metrics in phase 1. So now we need to actually understand the data, identify the application data sources. Where am I going to get the data? No matter where you're going to get it from, whether it be Epic, Cerner, Allscripts, another system, you've got to be able to understand the data and understand that maybe you need to do some data transformations. Do you have the KPIs? Maybe you don't have the exact KPI or metric that you're looking for, but you can use an alternative in its place until you can get that additional data. And maybe you need to do some interim staging. So once you understand the data, know where you're going to get the data, we like to say make a sample data. You can be as simple as putting 10 or 15 rows into an Excel spreadsheet, and make sure that you do have the correlation of the metrics and that you can understand where you're going to get that data. And then the last portion of the data phase would just be create a limited model with just a small set of data from a production system.
And so, Michele, we're currently, as a company, we're working with a national health system, and they did a great job defining their goals. And then they started to, and this sort of the step we have here is phase 2B, right? Can we get the KPIs? They recognized very early on that some of the metrics they were hoping to be able to manage on might not be obtainable. And they did a great job then of, as they were designing, just thinking through what do we want to measure, they did a great job of trying to identify alternate metrics that if they couldn't get the primary metric they wanted, were there other things that could be easily grabbed, easily sourced from the systems so that they could at least start building dashboards, start identifying and bringing to life, empowering the users to see what was going on. And I really highlight that. If you can't get the metric that somebody says, there may be alternative metrics that are almost as good that may also allow you to paint the picture to help the organization move forward with your visualization. So I like to stress that, and I think that's right here in that phase 2. Let's continue on with phase 3.
So now we've got a plan. We know where the data is going to come from. We've sort of done a limited pilot of modeling our data. So now we actually need to pilot the visual dashboards. So we're going to create some sample dashboards. We're going to get some feedback from a limited amount of users. And this step is sort of, you're going to probably do this 4 or 5 times until you get, a clear pilot that's going to work for all of your end users. And it's going to be using all of the phases so far that we've accomplished to really get to the end pilot dashboard.
Excellent. So let's look at some examples of what we might pilot. And these are examples that come out of the PDS dashboard library, which is one of the ways we help customers get jump-started into getting quick results. So potentially we might draft up something like this. You could draft this right into your web visualization tools. I'm still a big fan. I like Excel because I sort of have unlimited space. I can lay things out first. I like to start in Excel and then go to my web tool, as you'll see. But it doesn't matter what medium you want to work in. The goal is sketch something out you can bring to your pilot group, sketch something out and see if it's effective. Until you lay it out and try it, you know what data to work with. So here we've got very simple high impact, low impact denials. We have a very simple categorization that might have had to been culled out of the total denials, and you may not have categories for denials. Those may have to be built or transformed when you are modeling your sample. We can understand what's happened in the last 12 months and then the last 6 months. So very quickly I can see our denial rate is down. We can do comparisons to target or benchmark. Our goal here was 12%, and we're running 15.6. It's kind of hard to miss this. And of course, we can even then look at, how we're being reimbursed after we have a denial. And I think this very quickly articulates, without a denial, we're being reimbursed 54% of our charge. With a denial, we're only looking at 10.5. So there's an example. Now let's take our case example a little further here. And we might say, well, that's not quite as clear as we want to communicate denials to end users. We might revamp completely. Here's another approach that organizations have used. What I like about this is there's a sort of quick answers section. So we pulled from the elements that were effective, things like denial source, high impact, low impact. You'll see the same area in the bottom center of the screen. But this quick answers makes it much easier without even reading what the metrics are. You can quickly identify 4 out of 5 things we're doing well, we're missing one of them. We also simplified down and put just a 3-month trend in, and you can see trends over here for denied charges over 6 months. So, another perspective, what's the right one for your organization? It really depends on your goals. It depends on your audience, what you're trying to communicate to. At this point in the pilot, though, then we're going to jump in. If we haven't started in the analytics, we're going to jump into our analytics, and we might pull those same elements. If we know what we've designed, we know what worked, we know what the users liked. If you notice here on the screen, I've got high impact, I've got low impact. We've got things that look at the charges and the payers, so we could break that down further. We can understand there's those same likely sources. Maybe we wanted the same graph. And if you look over here on the left side, we can quickly see which departments and where we're having denials. Of course, with the web analytics, I can change, interact, slice and dice and drill, as you'll see further in some of the other examples. So stepping through the process, we've gotten through phase 3. We piloted, whether we actually pilot out through the web, we pilot out through Excel. Our goal is to tune and make sure what we're communicating is effective.
Great, and that's going to bring us to our last phase, which is the optimize for production. So what we want to do is take the pilots that we've done, as Russell said, either creating one or two in the visual tool or using Excel, and really start working and deploying that and being able to work on that production implementation. Again, you may want to start with a smaller group even when you go to production, but then eventually you're going to roll that out to an enterprise deployment where you may need to do some optimization and maybe apply some security. And again, you may still need to do some tuning even in this final optimization for production phase.
So let's go back to our example for a second. So this may have been effective. This may have worked. And if you have done this before rolling out dashboards, right, what's the first thing that happens as soon as you provide information and people digest it, they get used to seeing it? The next question is always, we want more, or what happened? Or in the case of denials, the question might be, what's the resolution? So running the same process, if you can stay one step ahead of your users, you might end up with something that looks like this. So now we have sort of page one is where are we getting denials, what's going on, right? It's what's happening. Page two, then we could start to stage out, are we getting paid after we have denials? Which payers, what's the volume of denials, and yet we're never getting paid? And of course, these visualizations are interactive. So I can point and click and quickly see what are the denied charges, and yet we have very low reimbursement rates after denial. And what are our trends? And where are those denials coming, and how long is it taking to get paid? So this second page, really run the same process. Run through your 4 phases. What are we trying to communicate? What are we trying to measure? And then what data do we have? And then you can start to build the joint visualizations, which we're going to look at in our second example as we move forward. So let's talk about that now. So the second example we wanted to bring in is really where you've done that very process. We've taken multiple visualizations. We've been building dashboards. We might have been building dashboards via Excel. We start to migrate them into the web. We have some front end. We know what we're trying to communicate. Now we want to really leverage the visualization tools. We want to optimize putting all of the information into one place. We want to make it easy for users to see what they need to see and then continue to ask more questions of the data and let the visualization guide them through that data. So let's take the example of, we want to optimize physician utilization, and I use the word utilization here very loosely because by the definition, if you look at the goals we've laid out for this project, it's physician productivity. It's looking for outliers. It's looking for the drivers of physician productivity while factoring in quality, while factoring the workload of the patients and their HCC scores and care gaps that might be impacting both productivity and quality, looking at patient satisfaction, and ultimately then making sure that our physician compensation is in alignment and the physicians and the department administrators understand how all these drivers build into a visualization. As we do this, some of the things that we might want to look at in our designs, coding curves, scheduling volumes, charge billing lag, and of course making sure that patient satisfaction is being measured because a physician who's rushing through their patients may have high volume, but their patients aren't being satisfied. We of course need to bring in, and we might want to look at budgets, quality indicators, the access to the physician, their availability, even how long they've been in play. Length of service is a very interesting metric because if you have 2 physicians and one's been with the organization 3 months and somebody else has been in your organization 5 years, we wouldn't look at them with the same benchmarks or drivers. And of course then bringing in salary and expense if we're going to look at physician comp, and even understanding the size of their panels and the acuity of their patients. One key thing I will stress, you'll see this in the dashboards I'm going to show here, you cannot build dashboards that speak or tell a story if we don't bring in appropriate benchmarks. Most organizations are using external benchmarks, some better than others. It's a challenge sometimes to know how to take what's done externally and bring it together to your specific need or a particular metric. We also, though, recommend it's very easy with the analytical tools to measure internal benchmarks. Compare the physicians against each other in this case. Compare departments to each other. So it's much easier to do that, and also a lot of times those benchmarks bring more context because you don't get the challenge of, well, how do we know that external benchmark applies to our market, to our business? My patients are sicker. Internal benchmarks eliminate a lot of that doing sort of peer-to-peer benchmarking. I mentioned this earlier. This is what is called a dossier project through MicroStrategy. I know people always ask what tool set are we showing. If you look across the screen, you'll see I've loaded up patient access scheduling, which is where we're going to start. But if you look down the screen, you'll actually see I have 6 or 7 visualizations all linked together here. So here we're looking at patient access. We have physicians. We have some basic scheduling statistics, how many patients were arrived, bumped, or canceled. We're looking at the last 2 months. We can see no-shows. We can see rescheduled. Okay, so this is kind of what's going on. Here we have utilization. This is where we're looking at, is the physician booked over schedule? In this case, this physician is scheduled 135% of available time, so clearly there's quite a bit of double booking going on there, or overbooking. This physician is only seeing patients 8.7% of their available time. Here we have third next available, which is a theoretical metric. And then what we here at PDS really like is this is the appointment lag from when they call to schedule an appointment to when they're actually going to be seen. We have some day of the week analysis and visit type. So with your interactive visualization looking across the data, we can pick out the physicians with the highest third next available. And we can very quickly then see, what their appointment lags are. And you typically would expect if somebody can't quickly be seen, you'd quickly expect you'd have a lot of physicians that are fully utilized. What jumps out at me is there's some outliers here that are not utilized. So why is it they have a high third next available when if you look at the points here, they're only seeing patients 63% of the time? Well, the visualization shows us and allows us to quickly isolate that. We can see that their appointment lag is well past 30 days in most cases. Their main area is follow-up, where we're seeing an issue. And then you can even see down here, potentially maybe it's because they're trying to pack all their patients in on Friday. We don't know exactly what's going on here, but we do have the ability to slice and dice or, look deeper into the data.
Right. One of the features that we've used in this dashboard is the ability to drill to the detail. So once you've identified your specific providers that you want to look at through that interactive visual dashboard, the users can then go and drill into the detail and actually get a better understanding of the data and do some additional analysis to figure out how we can adjust that particular challenge that we may have. Also, Russ, if you go back to the visualization and go into presentation mode, you can see how easy the visualizations, you can export data, you can get all of the data that supports this particular visualizations. If you want to share that with others, you could print out a PDF and share that with others as well.
Continuing through then on our visualizations, this is more a department perspective where we're looking across providers. We might also though want to push to the physician or give them access to their individual metrics. So the same data, once we built one visualization, is quickly changed where we can look at arrived, canceled, no-shows. We can look at their day of the week counts. We can look at their visit types or look at their appointment lags. So the visualization tools, once I built one at a department level, it's very easy to scale, scope, and then even lock down those tools down to the physician. Let's move through our example. So we looked at, how quickly are patients getting in. We looked at potentially analyzing, and you can see the data starting to tell a story, pointing us to where we might want to look. Let's now take the next perspective in our story, and let's see what actually is happening after the patient's been seen. So here what we're looking at in this visualization, and this is really designed to correlate, focused on physician productivity, bringing in benchmarks to compare them, and then helping understand the drivers that would impact a physician from being a top performer on their work RVUs or a bottom performer where they're not hitting even close to where their goals are. So in this dashboard, you can see across the departments, you can see the physicians, but we've correlated in the billing charge lag, how quickly is the physician turning in their charges. We've correlated in the percentage of E&M coding against the CMS benchmark. We're looking at their scheduling volume from the previous visualization, understanding how busy are the physicians, how many appointments are they actually seeing, and then, patient satisfaction scores. Then further down the page, you can see a number of different visualizations. I really like the fact that very quickly you can highlight and see red, yellow, green, who's performing well and who's performing poorly.
Right, Russ, and in order to do the red, yellow, green, we've actually used the targets and benchmarks that you spoke about earlier, how important they are in order to really understand the data. And we've used conditional formatting against those benchmarks and just applied some simple colors, red, yellow, green, to understand who's meeting their goals or who's may not may not be meeting the goals that have been set forth.
So here you can see I quickly highlighted the bottom performers on RVUs. I then might want to look and see, well, who's turning in their charges late. Very quickly, as I continue to filter, right away you can see, geriatric, we're having some issues. If we wanted to look at those that are having coding issues, I can just quickly highlight the bottom left corner here. Or if I want to look at those physicians that are missing their patient satisfaction scores, and the visualization really just allows me to keep drilling down and drilling down and drilling down. Okay, so very quickly we can see, if we were looking for starting points, these two physicians are probably the ones that if we can move them up, get them to see more patients, fix their quality scores or their patient sat scores, we're going to have a very significant impact on the organization. 80-20 rule, start with where you have the highest impact and either move them up and make change. The other thing that you can do, though, we talk about this all the time at PDS, it's not always about who's performing poorly. You can very quickly go to the other side and say, how do we model the best physicians? How do we use them as examples? How do we look at our top performers? So how do we quickly identify who's doing a great job with this and, potentially use them to become, our best practices and highlight what's working and why and how are they structured? So, dashboards can be used both ways. And of course, at any point, as Michele said earlier, slice and dice and drill down. Let's continue through these multiple visualizations here. I already touched on this correlation graph looking at patient risk acuity and where those patients are assigned. Let's look at a more complex visualization that not only looks at the HCCs of all the patients, but it looks at their risk scores. We can quickly start to see volume of patients. In another example we have here at PDS, we can even assign revenue or the cost of that patient panel to a physician. Very quickly, again, here, though, you'll see we're using this kind of green, orange, yellow. We could look at our, sickest patients, start to understand what HCCs they have, which physicians have the most of those patients. And even through some of the analytics, a little more complex technology, we can click and highlight and know where are their care gaps, because these patients have higher risk scores than they've been seen for or we've coded for this year. So this is a visualization, but it's making it easy to start to identify. And then, of course, we could communicate out any of these panels. Once I built it, it's very easy to rearrange the data and go down to an individual physician or apply the security as we talked about. Going a little further through our visualizations then, ultimately, if we're focused on physician and we talk about utilization, we have to bring in compensation. And what I like about the way this visualization and this story lays out is if our goal is to both communicate to physicians where are the key things they need to be driving, how to make sure they're maintaining patient satisfaction, what are the drivers that would maximize the revenue, and then we start to bring in compensation, expense data. A good compensation plan, and we've talked about this in past webinars, is going to include components that tie in with Medicare MSSP plans or shared savings plans. So we want to make sure that we've got some component of the physician's compensation tied to a quality score, as you'll see here, tied to a patient access score. Okay. We also want to be able to show how they're trending, how their performance is, and if they're not hitting their scores, what's the actual impact of this? So if you think about telling a story through, although we've mixed somewhat departments and physicians, you start to get a feel for what's going on here in that you could structure and make it easy so a physician could see all of the different layers. A department administrator could see all the different layers. And that's the last visualization that I want to show here in this section, which is let's take that same compensation and let's show it back to the administrators or into finance so they can start to see, again, where are those performance gaps and how do we make sure both our visualizations, but our performance and our leadership is driving to improve our goals, right? So here again, here's all the physicians' comp being calculated. And we're now looking at, here you can see our top earning physicians. We can see where they sit within the organization. We're looking at paid comp versus calculated comp. And then down here, this is the incentive pools. And I talked about being able to highlight where the physicians aren't maximizing their revenue. They aren't hitting their quality goals. Again, through the visualizations, you can really quickly see this is where those physicians sit. And you'll notice I just quickly filtered through, and we can see that we have a number of physicians failing in cardiology. So then we might want to dig further and just focus on cardiology, and we can start to see these are the 5 physicians. And if we wanted to continue, whether it's to focus in on the bottom two physicians and say, well, if you want to get your earnings up, we need to work on moving your quality scores. Or maybe as we're adjusting compensation plans, we want to look at our top performers and we want to say, well, as much as we're trying to add incentives to quality, they're not moving the physicians to change their behavior enough to make sure that's a priority. And so maybe we need to think about, as we evolve our plans, we want to make sure our plans are in alignment with our payers, that we're moving in that direction.
Great. So even though you may be following this phased approach, there are a few things that you want to watch out for as you start creating the visual dashboards. And I like to refer to the first one as picking the software tool first. So during the phase approach, we talked about having a plan, knowing where you're going to get the data. So even if you have a visualization tool, if you have no plan and you have no data and you're not following that first step, you're not really going to be able to effectively visualize your data, because without any data, you can't really visualize it. So even though you've picked a tool to use it, you need to be able to identify what you want to visualize. And then not identifying resources or providing time for training, resources to create the dashboards, as well as resources to help educate the end users on how to interpret those visual dashboards. And the same with training. You may need some technical training, or you may need to be able to train the end users, again, how to use the visual dashboards and get the most out of the information that you've provided them.
Excellent. I talk with organizations all the time all over the country, and the first two things you highlighted here, Michele, really speak true. We bought a tool, but can you help us make it successful, PDS? And my next question is always, well, who's trained on the tool? Well, we're not sure, or we don't have resources, or we're still trying to figure out if we need to hire somebody or bring somebody in. Just not a good, if we go back to our phases, right? Do we have clear goals? First off, the first question always is, what are we trying to accomplish? If it's just visualization for the sake of visualization, okay. But if we think about applying, we've got a tool, let's pick a goal. Let's take something we can do. Let's make sure we have the data to do it. Just recently, though, I've also run into, and I hear organizations saying, well, we can't do anything because we can't get the data. We're with a certain vendor and the data is very hard to pull out. Yeah, that is a problem. And I do sometimes hear organizations saying, well, instead of building on what we've done, we're going to shoot for the moon. Yeah, that isn't a great strategy either. At the same time, don't let not being able to get the data be an obstacle. Go back to about what we talked about in phase 2, Michele. Your point was well taken about, are there alternative metrics that we could work with? Clear goals, like we talked about in phase 1. And then there really is a challenge here, and I think if you've tried to do this, if you're on the call and you've tried to build that visualization, it really comes back to, do you have experience in your organization presenting data? There is a bit of a art to that. As much as you might want to say it's a science, but I think if you have clear goals and you step through the process, it becomes a little easier, in terms of, does this one chart, does this one page communicate what our goals are? So clear goals makes it easier to start through that process.
So as we talked about in the phased approach, so having clear goals is one of the key success factors. Having a clear plan and following a process that builds on achievable steps. In other words, following the 4-phased approach. And then really applying a realistic time frame. We talked about maybe using alternative metrics. So you may have a short-term objective that can lead to a long-term objective. Use an alternative metric until you can get appropriate data modeling and get the full implementation. And then again, back to assessing your skills and resources. Be realistic about that, about what resources you have, what skills you have, and then also leverage the designs and templates and the phased proven approach here. And you have dashboards probably that you're publishing today. Use those as your leverage to move to the visualization. Use those as your plans. They're working today, so move them to the next level, which would be put them into the visualization.
Excellent. Yeah, it's really easier to start with what you're doing and move them forward before you try to tackle something that you don't have any experience in, or you don't have any data in, or you've never presented to. which leads into my next point. That is, so here at PDS, if you're not familiar with us, we have a number of customers on the line. Thank you for being a customer. But some of the ways that we assist our customers is we have a library of starter templates that our customers can access. And they're, some of what you've seen in this webinar are those examples. So depending upon the area or topic, you can, leveraging what somebody else has done is a great place to start. Obviously, the internet is full of examples of data. Sometimes you can find good things given the, if you're in a particular department looking at a very focused specialty or subspecialty, you may need help with that. But start with any kind of starting points is helpful. We also here at PDS have tools to simplify piloting data. We have one tool in particular that we use that can both help you pilot data into Excel or feed data into your visualization tool. A few of the more involved things, modeling data, calculating risk scores, for example, or relating expense data back to productivity data, does involve modeling. And so we do offer and do staging and modeling. And of course, we have methodologies like the one you're hearing today that help us move through these processes very quickly. And then further, we support our clients with ongoing training, workshops, and support. And that's really what we do here at PDS. So I want to thank you all for joining us, and I hope you found this valuable, and have a wonderful, wonderful day.